Does anything you do at work actively aggravate this as a rule?
No.
Right.
I mean, I've always done it,
Yeah.
Stephen, you know.
Yeah.
I was telling Laurie earlier on, I'm now 61 and I was doing radio when I was 5.
Yeah.
You know, so I've always done this kind of stuff, you know.
Yeah.
And this is the arm that I use, you know. And that's why I wouldn't have come to see anyone, because I have to use my arm, and you just go through stuff. And that's what's interesting. People say to me, well, it's a man thing, you know, that's what men do. And I don't know whether that's any different reaction from a female reaction. But one has to get on with one's life, Laurie, you know. I've got a garden that needs digging this weekend, so it has to be done, you know. Or is that reckless? Is that reckless behaviour?
I think it is, because if you're using the left hand, there's a lot of strain on the elbow in that.
So stay in and watch telly this weekend.
Yes. Get somebody else to do the job.
Six Nations, what are you doing in the garden?
Oh, man.
We've got a few more questions. Laurie, what do you think about ice and heat?
I think ice is very good if it's acute. This is acute, but it's in such a small area, it's been there so long, it's not going to make a lot of difference. If it's hot, and then ice is very good. That reduces it. Heat I don't like, because it makes it worse. It increases the swelling, and that makes the thing worse. So if it's acute, ice. If it's chronic, then maybe heat.
And do you have a theory on how long people should apply the ice?
30 seconds, off for a minute, on again 30 seconds. Longer than that, you start to get burns, and that's no good.
Right. But of course, we're always going to put some sort of material between ice and the skin, unless it's in one of those packs that says you can do otherwise.